Good morning. This is Bella's video for SRT analysis. She's a 9.5-year-old spay female, Maltese mix. Presentation for ears with narrow canals, having issues in the private area with licking and biting, scooting and chewing feet. So that's our expression. And then I wanted to discuss the diseases, and I liked this statement by Dr. Hans Heinrich Reckeweg. The statement was, diseases are biologically purposeful defense mechanisms against internal and external homotoxins, so certain toxins of the body, or the expression of the organism's effort to compensate for toxic damage it has sustained. And so at 9.5, sometimes we do have compensation as well as defense mechanisms, but I thought it was interesting, biologically purposeful, which means that it's a genetic expression of a problem they are trying to solve versus something that's invading them. The environment plays a big factor because environment does have the ability to alter genetic expression, and cause inflammation, infection, injury, those kind of things. And so, if we look at her SRT, the diseases, I found it interesting. Main takeaways was skin. What was most chronic was the torso of the deep back, and also the neck area, which can trap the lymphatics. So the main takeaway was the lymph system, the lymphatic system, is trapping toxins. And those toxins are expressed through the skin and through the ears and the lower part of the body, because if we're talking about the deep back, the private area, we're going to have issues maybe with urine output or lymphatic flow to that area, which can trap moisture and lead to yeast infection or bacterial inflammation, those kind of organisms, and sometimes can be chronic, and so as we're using the SRT drops, we're going to be resolving the dis-ease and help the body to eliminate toxins, but reduce the biologically purposeful reason to turn on those defense mechanisms such as inflammation, immune cell issues, certainly the immune system attacking where the areas of the problem of the body are. So I feel it's important when we look at those chronics is that they've been there for some time. She's 9.5, but we get resolution when we restore the body back to a state of balance. And how we do that is we remember positive 20, negative 20. This is a normal healing area. Chronics tend to live down here. What we want to do is get those moving back to restoration. And so they're not permanently stuck, although as they get older, closer to 10 plus years of age, sometimes we do have to manage the compensation effort as the body gets older. But review the video. Thank you for choosing a video. I think this is helpful to be able to visualize. I like to go to the whiteboard and write some things down for you as well. I'm going to upload this one to YouTube versus the email. You're going to see a code that you can add to the search engine to pull that up. And then just let me know what you think of this video. Thanks so much.